Health centers are very critical in the management and control of COVID-19. Indeed, Ghana's capacity has been questioned by many people who are observing on the sidelines. Health professionals are doing what they have to do, but health professionals operate in health facilities. Now, in Ghana, the National COVID-19 Center is the East Municipal Hospital, where we have come to today to see what they have, what facilities they have, what staff they have, and how they are managing the COVID-19 cases here in Ghana to ensure there is no further spread. So if you want to come with me for that conversation. Now, if you already have tested positive, what happens to you? Do we have the capacity in the country to deal with it? The government has said they have the necessary infrastructure to support that. What we have come to do today is to see which facility is leading this particular charge and how they are faring in terms of addressing this concern. I'm privileged to be joined for this interview by 3 officials who run this particular place. What is the various categories that you have of patients who come here?
Okay, so there are cases that come in asymptomatic, meaning they don't have any symptoms. And the majority are those who were in quarantine from the various airlines or in the various hotels. And then we have those with mild symptoms, maybe a cough here, sore throat here. So they are the patients with mild symptoms. Okay. They have those we call moderate. So the moderate symptoms will have cough, may have a fever, may have some slight difficulty in breathing. Mm-hmm. Then we have the severe cases. Those are the ones who will have to move into the intensive care. Not that they are on a ventilator, but maybe they are oxygen dependent. They need oxygen constantly. And then we have the critical cases. The critical cases are the ones we put on a ventilator. Okay. So that is the mix of patients that are coming into this facility.
Let me bring you in. There must be very serious cases and there must be also mild cases. Can you break that down for us and tell us how you're managing these over here?
Among those who show symptoms or who are ill, as you said, some would be just mildly ill. The mildly ill patients, even when they are in hospital care, are usually those that we keep in a normal ward and then look after them, monitor what is happening to their symptoms, make sure that they are either getting better, and if they're not getting better and they're getting worse, then we can escalate their care. Okay. Now, some will be moderately ill, having a pneumonia, which is more or less like a mild pneumonia, not a severe pneumonia. And then these ones, we need to keep a closer eye. So in the hospital here, those who are mild, we have wards that we keep them. We segregate them based on their level of illness.
Moving forward, the issue that will be discussed is how your own capacity is. So you are one isolated hospital, you are very new, not many people know about these places, and you are in here, you are supposed to be doing this special treatment. What do you need the public to assist you with, and does the government give you all you need to keep running as you want?
We've had support from government, but again, we've had support from some partners. That is where there's a bit of a challenge, I must admit, because there are some members of staff who have moved from their homes to come and lodge here so they can continue to provide care. Okay. And therefore, feeding becomes an issue, especially in this lockdown. So we need a lot of support in that area.
Explain to me, Doc. So this is like an alleyway, and I've seen luggage there. I've seen red tape, yellow tape. Now, when the person is brought in, and usually an ambulance, that you said ambulances bring all the people here, then what happens next? The assumption for many is that when people come here, they are all lying in beds, they are on oxygen and all of those things. Is that what you have here, or you have patients who are actually moving around, who are walking and so on?
So it depends on state and temperature, but most of our patients who come in, 98% of our patients from mandatory quarantine to mandatory isolation are asymptomatic. They do not have symptoms. They actually walk into their rooms, they are given their beds. Like we told you earlier on, we have places we have taped with caution tapes. So the patients are free to walk around. The patients are having their aerobics whilst here. They are playing their draft whilst here. They are playing cards whilst here. Most of them are sitting outside and they are having a chat. Remember, they are all travelers who are not ill.
This is our continuous coverage of the COVID-19 and how it's been managed in Ghana. Today we are at the Ghana East Municipal Hospital, which is like the national center for treating COVID-19. As we speak, there are over 55 patients here. Now, in your mind, patients will be lying in hospital beds, perhaps coughing, because we've heard of what symptoms people with COVID-19 exhibit. That is not the case here. These are people who are moving freely. There are two young men playing cards on the table. These are confirmed cases, and they're living their life normally. I would attempt to speak to one of them if the doctors have given me the all clear. And indeed, I'm told the doctors have given me the all clear. And the patient has also agreed to speak to me. He's going to be invited to join us shortly for an interview. All right, so I'm going to speak to... What's your name?
Yeah, my name is Frederick Dra.
When did you test positive for COVID-19?
Yes, it was one fateful Tuesday, midnight, around 12:15. Then I realized that I was feeling feverish. So the following day, I went to hospital at Tema Port Clinic. Then at the port, they took my temperatures. They did malaria tests. They did other kinds of tests. But they told me there's nothing like malaria. There's nothing like other sicknesses. So they found out that since there's something wrong somewhere. So they took the sample through my throat. Then they asked me to go home. They gave me medications. I went home. So the following day, then I received a call that, are you Mr. So and so? I said, yes, I'm Mr. So and so. Then the man just said, yes, because you went to hospital the other day, they've tested you and they found out that you are positive. I said, all right. So we booked appointment for them to convey me through them from that place to wherever I am today. And I think they picked me on Friday. I think Friday to this place.
From Tema.
From Tema. So since then, the first day, I think I was the first person to come here. But the treatment, the doctors, the nurses, they did very well. That currently I'm strong. People have been coming in. They tested them. Nothing happened to them, and then go home.
If we can walk this way, so that we can.
As I'm standing here, with the help of the doctors, the nurses, the treatment they give us here, I am more than stronger.
Tell me about how you got this. Did you travel outside the Ghana to go get this disease? How do you have an idea?
Yes, actually, I did not travel. I was within the country. But I can remember I had a friend who came from South Korea. That was early February. So this friend of mine came, we had a chat, we sat down, have a whole lot of things. Then he left. When he left, I did not experience anything. So about this fateful day that I was talking about, that brought the whole show that I was feeling feverish and I went to the hospital. So I thought maybe it may be the guy my friend who came from Korea, South Korea. He was the one, maybe through him I had that, because I had close contact with him in terms of.
Has he tested positive? Have you been in touch with him?
Yes, I called him and I asked him. He said, yes, since said he was also tested positive. But God so good, he was still within the country. So he went to Kumasi, and through that, he was also receiving his medication over there.
So he's also a positive case, and he's been
yes.
In the community. So you are the one who was described as the first community case in Tema. How did the community react to this announcement that Mr. Dra had tested positive for COVID-19?
Actually, in the community, I would just say I don't know whether the information have been there. Yes, because that Wednesday when they tested me, they called me. The doctor told me I should be indoors. Yes, so since then I was indoors. I did not go out. I did not receive visitors. My family was there. I was somehow back from my family, but my wife was closer to me, but not all that closer because I have been informed.
So no member of your family has tested?
Yes, no, all of my family. Since then, the doctors also did very well. Okay. There was a team who always visits my family. They check their temperatures and all kinds of tests. But God's so good, for some time, about 6 days now, they've stopped going there, showing that they are negative.
Tell us what's going through your head as a COVID-19 patient. Are you afraid? Are you worried about how you have been treated? What is generally in your mind?
Yes, I am not afraid, but the initial stages, the way the information goes round all over, made it as if when you are tested positive, the following day you die. But not knowing, when I came here, as the first person who stepped my foot here, it wasn't like that. So my people out there should know that COVID-19 actually, yes, it's a virus, but that doesn't mean that when you are positive, you die. Nobody dies like that.
What are your plans? What's your hope? When do you hope to leave here?
Yes, currently, my hope is that I've discussed with the doctors. They tested me positive. They had a means of testing me positive. So I want them to test me and find out that I'm negative so that I can join my family.
Yep. Well, we are still touring the Ghana East Municipal Hospital, which is the center, the national center for treating lots of COVID-19 cases. And I'm touring with doctors or officials who run this place. Where are we now?
Yeah, so Umaru, as we said earlier on, we're just coming from the mild, where those who are not symptomatic and who are mild are. It's where we call the donning of PPE room. Mm-hmm. So our protective equipment are put on by the staff here. Okay, so they come from the staff area, all this place is still clean area. They go in here, and then those who are going to the patient will wear all their protective equipment, supervised by their colleague to make sure that everything is intact. They plan a schedule of what time and what they're going to do, and that schedule is affected by the condition of their patient. So if they have patients that will require more frequent entry, then they will draw a schedule based on that. So the treatment plan is actually drawn carefully, because you want to be able to be prepared at a time. It takes quite a while to actually finish putting on the personal protective equipment.
Just talk to him before you go. Hello, now you look like an astronaut. Can you hear me?
I can.
When you can talk?
Yes. Can you hear me?
I can hear you. You have a little bass though. Do you do this often?
Well, I do this every shift I have to go in. And without this, we are not allowed to go in.
I see. Yeah. How do you feel as a healthcare provider being at the front line?
Well, initially we were all scared, but with sensitization and then being spoken to by our psychologists and all of that, now we're not so scared. Especially wearing all of this protective gear, we know if we take the right precautions, there's no way we're going to contract the disease. So I'm not so scared anymore.